Monica, Vohra, thank you so much for joining us today to talk about the Health Equity Compact.
Thank you for having me, Natalie.
Awesome. So as a member of the Health Equity Compact, could you tell our viewers a little bit about what it is and what that entails?
Of course, the Health Equity Compact is a group of over 85 leaders of color who've come together with a shared commitment to improving health outcomes for everyone in Massachusetts, regardless of their race, their gender, their immigration status. That is our mission and vision, is really to dismantle inequities and any barriers there are to accessing health care.
So every year you meet for a Health Equity Summit. Tell us a little bit about the summit, what goes on, and why it's important to have conversations like this.
Yes, of course. So the Health Equity Trend Summit is an annual gathering, and it's leaders who are committed to advancing health equity. So the members, of course, are very involved in this, but we see people come from across all different sectors: business, community, healthcare, government, and it's really an opportunity to recommit to our mission of advancing health equity. We hear from experts and leaders from across different sectors, and again, it's an opportunity for us to come together and really say that in Massachusetts we are going to do whatever we can to make sure that everyone can have access to high quality care.
Right, and Massachusetts is known to be this huge health hub where all of the best research is happening, right? But there's still these huge disparities in our communities. What are some of those main issues that you're addressing?
We still see that Black mothers are close to 2 times as likely to die from maternal health issues. We also know that our Latino children are more likely to be disproportionately impacted by asthma and diabetes. And one of the statistics I think that really gives me pause is that an individual living in Roxbury is likely to die 23 years on average earlier than their neighbor in Back Bay. That's incredible. Where you live should not dictate how long you live. And that's exactly what we are trying to break down, so that that no longer is the reality of our state and our country.
Yeah, I mean, less than 2 miles away, almost 30 years of your life, that's staggering, like you said. And, why are these disparities so significant? How can we better support them?
The state of Massachusetts is a leader when it comes to providing Medicaid benefits to almost everyone. And all of the improvements that we've made, they're under threat right now. And so we're really worried that we're gonna see things go in the reverse direction. The way that we can continue to make progress is by investing in community health centers like myself, by investing in primary care, which Governor Healy recently made a very significant step in creating the primary care task force, by changing our payment methodology and making sure that we also change the primary care workforce. So most recently, Governor Healy actually had put into law a pathway for foreign medical graduates to practice as clinicians here. We need more healthcare staff to look like the people that we serve. That's how we're going to build trust with our community.
Like we were saying earlier, Massachusetts is this hub for health, and it's also an extremely diverse place. Yes. Being known as a sanctuary state and a sanctuary city like Boston, we welcome in all of these people, but we maybe don't have, the services to back that up. So it's extremely important to have, the Health Equity Compact and DotHouse as well. So what sets Massachusetts and Boston apart from other states?
I think a few different things. I think going back to, not just this administration, but prior administrations, as far as, who's held governorship, we've had that commitment. We also have incredible academic institutions here training the future clinicians. The other thing is, for the longest time, we have expanded those Medicaid benefits. We recognize that your immigration status should not hinder you from having healthcare benefits.
Absolutely.
When we don't provide those benefits to patients, those individuals end up in our emergency rooms. And that affects all of us. It's not just the folks who are in those EDs. It's all of us who are there looking for care, and experiencing hour-long waits, You know, you see gurneys in the emergency room because there's no place to have somebody stay, to find a bed in the hospital.
Right, to just triage somebody, right?
Exactly. Emergency rooms are for emergencies.
Yeah.
It costs everyone financially and their health when we as a state don't commit to improving health outcomes for everyone. We have more community health centers here than any other state, is my understanding.
Wow.
And federally qualified health centers are required, and it's our privilege, to take care of anyone that walks in that door. It does not matter if they can pay for their service. It does not matter if they are insured.
And what does that investment look like long term? What are some of your goals?
Sure. So I think that our goals can really be captured in our in the Compact's omnibus bill, and that's an act to advance health equity and health equity benchmarks. And this bill is actually going to be scheduled for a hearing in July. And it essentially is bucketed into 3 areas. The first is expanding care, access to health care, which includes increasing access to telehealth services, interpreters services, and Medicaid benefits. We know that there's a threat to Medicaid benefits. There's a potential of 1.7 billion cuts that are being proposed by the federal government. And you know, what that does, if I could just put a story to that fact, is to that data, is it's patients like the person who I think of, which is a mom of 3 in her 40s, who came to me who doesn't have a job, doesn't have a car, doesn't have financial support from anyone else, and she's on Medicaid, MassHealth, our state Medicaid. And you know, when she tells me how difficult it is to have a job, it makes sense. I mean, she has to schedule her interviews while her 2 children are at school. The third one is 2. What does she do with that child? There's, you know, as far as childcare goes. And you know, she has to access food benefits, she has to access healthcare benefits. All of that is being supported by our state Medicaid agency.
That's just one story
Just
that's
one story.
reflected, you know, thousands of times in our state. And, you know, investing in these people only brings us all up, right?
Absolutely.
So thank you so much, Monica, for joining us today, talk about all these important issues and for supporting our vulnerable communities.
Thank you so much for having me and for elevating this very important topic, particularly at this time.
Awesome. Could you tell our viewers where they can learn more?
Absolutely. You can learn more at www.healthequitycompact.org. And if you're interested in learning more about federally qualified health centers and the services that we provide, your viewers can visit www.dothousehealth.org.
Awesome. Thank you so much, Monica.
Thank you.